I'll close my door so you don't have to. Oops, have my audio.
Well, while everyone is logging on, I'll just say hi and welcome to June and the other side of session, which is a great thing. I'm not sure if Claudio is on yet. And there you are. Hi.
Right on cue. How are you?
Good, thanks. And Tammy will be joining us, Representative Exum will be joining us as she's able. We're not quite sure at what point, but looking forward to seeing her. And I just want to welcome everyone. It has been quite the time that we, coming on the other side of session and trying to get some rest and also, sharing legislative updates around the district for members of the legislature. So I'm glad that we're having this meeting. I'm sad not to see you all in person, but I certainly respect the fact that people are busy and we're in the summer months and there are different priorities at that point. So I'll turn it over to Claudio.
Thank you, Senator Marr, and thanks everyone for convening. And yes, a very important opportunity for us to sort of debrief on some of the big policy changes, budget, legislative work, but also orient ourselves for the work that's going to continue. We have a busy summer and fall ahead and gearing right back up with a lot of the studies that we had all scoped out as part of our multi-year strategic vision. So I'm excited for today's conversation, excited for questions and answers and all the feedback from our TCB colleagues, and also looking forward to a little bit of well-deserved time off for everyone. I hope we can all take some time this summer to recharge and refresh with loved ones, families, and friends. So with that, I'll turn it back to our next agenda item.
So Emily, you want to take that on?
Yeah. So I will share my screen to project the agenda and just give a quick overview of what's on the agenda for today. So first, just a review and acceptance of the May minutes. Then we'll be doing a legislative session overview and updates. And then some Talia Justice Institute work group and administrative updates. And then Jill Farrell from Yukon Innovations will be presenting on the services array gap survey and provide an overview on the data report she has been working on. So that being said, I will put a motion forward to approve the May minutes.
Second.
Emily, do we want to do a voice vote?
Sure.
Okay. All those in favor signal by saying aye. Aye.
Aye.
Aye.
Any opposed? Abstentions? Seeing none, so ordered. They're adopted. Thank you, Emily.
Thank you. So I will share my screen again and move on to the next agenda item. Before we kind of dive into this, I'm not sure, Claudio or Senator Marr, if you had anything you wanted to add before we begin.
Yeah, I would just like to say that it was another fast and furious legislative session. There were, I believe, several thousand. I heard one number of 3,000. I heard another number of 4,000 bills that were proposed this past legislative session, of which around 280 bills were actually passed. And we do have some updates for you on that. We had a couple of disappointments, but we all feel good about it because we feel as though we have things well in control for how that is going to work forward. So let's talk about the recommendations that were put forward, and we'll go kind of high level update because I don't want to spend, it's a long list and I know that Emily shared it all with you. So how about if we do a high level update and then we'll open it for questions. Does that sound good? And Claudio, I'll lead off.
Right.
There, can I ask you to lead? No, that's okay. I am
Yeah.
waiting.
I know, it's been,
Phone call, but when it comes, I will take it. So I will lead off and let me go back to my Zoom and starting with, 5001. Okay. Starting with 5001. This is a report to the Education and Children's Committee examining recommendations on behavioral health issues affecting special education students. As everyone probably followed, we had a lot of focus on special education this year in the legislative session and made some good progress. There's more to be accomplished. And to that end, we're looking for a report on the behavioral health policy and to the General Assembly. And the report's going to consist, I don't want to read all this because that just seems silly. But let's go down to the next one, Emily.
Senator Mar, if I could just add some context on that one. I just think the real takeaway, I think, on that one is typically for those who are familiar with the legislative process, certainly Senate Bill 1s through 10 and Senate Bill 5001 carry with them some esteem and some recognition and notoriety as being in the Senate, 1 through 10, typically being caucus bills, meaning leadership and all the majority party is putting them forward as a caucus priority, elevating them as distinct and apart and something that they believe are critical to pass in the year. And 5001 has that similar cachet with respect to the House being the Speaker's priority bill. So it's again a mark of distinction and honor that as part of the 5001 signature package in the House, they thought of TCB as a place to vest some of that important work as it intersects with some of the special education pieces and behavioral health. So I think that's a kudo to the work that we've done and the recognition we've built as being serious about the mission and focused to getting to operational outcomes.
Claudia, I always appreciate you. Thank you so much. That was great. Far better job than what I did. Okay. The second one is House Bill 7287, collaborating with the Department of Education and Department of Social Services to develop a framework and operational guidelines to streamline municipal Medicaid billing for Medicaid eligible school-based behavioral health services. Do you want to speak to that, Claudio?
Yes, on this one, I'll just say this was a specific recommendation that we had approved. I know that some of us have had the opportunity to visit some of our school-based services and recognizing that there's more and more a multi-layered approach in the delivery of care in our school systems beyond school-based health centers. And this particular piece of statute recommendation here is going to help us untangle and make sure that we're maximizing.
Claudia, you froze. Oh. Okay. Well, we're waiting for Claudio to come back. Yeah, I just think this is very important. It was included in our recommended language. And then, oh gosh, because I want Claudio to do the next one, which is Medicaid. Why don't we skip the recommendations which address the Medicaid language, because that is Claudio's absolute bailiwick, and go to mobile crisis recommendations. Yeah. Okay. So the mobile crisis recommendations, this was included. Excuse me, Emily, Claudia says he got kicked out of Zoom. Can we let him in?
It might just be like a service connection issue. He should be
Okay.
able to log back on.
Okay, let me just let him know that. Okay. Okay, sorry, everyone. Okay, mobile crisis funding recommendation. This was very important to all of us to sustain the 24/7 mobile crisis expansion, initially funded through ARPA. And this funding did make it into the budget. So we were really excited about this and very pleased. Urgent crisis centers insurance review. While this did not make it through the legislature, we are going to convene a UCC ad hoc work group, and it'll be formed with the behavioral health advocate, along with identified individuals to assess and provide data. So although this did not pass in the legislature because of last minute bills, what we do know is that we don't have to wait because we know how important that is. So we can get started on an ad hoc work group and then make recommendations to us for the next legislative session. The next one is the certified community behavioral health clinics. It was recommendations that we include the CCBHCs planning and designing a grant for the development of separately payable acuity-based care coordination, value-based payment models, and navigation support. So Commissioner of Social Services, oh my gosh, it's not letting him join, Emily.
Okay.
I'll let you.
We have had an outage of internet at the OPM office, so I'm joining by phone. Not ideal. Hopefully we get restored, but I'm able to join back in.
Oh, great. Good to see you. So we skipped over the Medicaid piece since that is your in-depth knowledge along with everything, a lot of other things. And right now we're at the CCBHCs. And what we're doing here is looking at a study no later than September 1st. The Commissioner of Social Services will file the report on, I'm sorry, not a study, on how, on the status of the planning grant.
Yeah, and the good news with this one is that DSS has already secured a nearly $1 million planning grant. And there's some formality for how that planning is going to be undertaken. So we're going to continue to move forward with DSS's process, and having had the benefit of TCB already engaged and knowing that this is a priority, I think a lot of the feedback that TCB has already provided and will continue to provide will shape what become parts of that planning grant and what we ultimately will put forward to the feds for consideration as a potential model to operationalize here. And I know Alice has had strong feelings about it, and there's some really good opportunities to weave in there enhanced care coordination and wraparound support. So look forward to that work continuing, and glad that our DSS partners on this committee will be a conduit to that work.
Okay, should we go back up to the Medicaid rates recommendations, Emily? Okay, Claudia, can you see it?
No, but that's okay. I think I know it for now. So the budget did include money for rate reinvestment in Medicaid based on findings from the DSS study that was undertaken. And many of you will recall the study was done in two parts. The first part of the study focused on behavioral health needs, physician practices, physician fee schedule, as well as dental. And then the second half of the rate study was the remaining balance of the Medicaid system. And after the two-part study was complete, DSS put forward some ideas for where best to put in dollars and resources to maximize access issues and to make sure that our Medicaid clients get the benefit of the most rich, robust outcomes available. So the budget has put in placeholder amounts for funding based on what was identified as priority needs in the rate study, and DSS is developing straw proposals now that they'll share with key stakeholder groups for input and evaluation. Part of that money will be set aside for FQHCs. FQHCs have not been rebased or had a significant service increase for over 20 years since we established their prospective payment model and their bundled rate that exists today. They do get an MEI, a Medicare index inflation amount every year per federal law. But this is the first time that we're going to be able to put some significant resources in. I think that's important because it's an area where they accept all patients based on ability to pay. So whether you have insurance, no insurance, or not great insurance, there's a sliding fee schedule for what you will pay based on what you can afford. And it's a comprehensive experience. A lot of our FQHCs are able to deliver not only primary care, but also behavioral health care. So it's a good spot as a safety net provider to plug some of our Medicaid resources into. So that will be one of the priority areas. And the rest, the balance will be based on some straw proposals that DSS has started to work on and will socialize with key groups.
Okay, thank you. The ICAPS model development, the recommendations were that we would take a look at the ICAPS with a new consider the needs and time demands placed on families and children and the ability to deliver the positive outcomes, and that we would contract with Yale Study Center to determine additional federal funding and reimbursements, conduct a randomized control, and look as an evidence-based treatment program with interim recommendations by 2025. Basically, what ended up happening is our next steps is TCB will continue to work in collaboration with Yale to develop the scope of work, and the TCB services group will monitor and track the progress of the studies. So anything to add there, Claudio?
Yeah, just a little context. This one is really exciting to me because it's an opportunity for us to use the limited dollars we have at TCB to maybe unlock some new federal resources. So one thing that came to our attention over the course of developing this recommendation is that ICAPS, for all of its really strong and compelling use case and outcomes, has never been validated as evidence-based. And so designing a random controlled trial where there's going to be a fair comparator, I think that's been part of the problem up to now, is that there wasn't a fair comparison for what intervention would look like versus not intervention, is going to help us make sure that it gets the recognition it deserves and that there may be opportunities for new federal dollars to support it, which is always a nice value add. A little bit of money may go a longer way here.
Great. And then moving on to the, this was, I mean, I have a tendency to say things that disappointed me. So I'm just going to say that this was very disappointing, amending the age of insurance coverage for individuals with ASD utilizing ABA therapies. This was part of a bill that did not get through the legislature at the very last minute, but we are undeterred and are going to continue working on this as we move forward. Then the crisis continuum review recommended that we conduct a study to review utilization and anticipated demands of the behavioral health crisis continuum, included what the studies should be, and a report by 2025. TCB is going to work with CHDI and DCF to identify data collected in regards to the study, and the services work group will track and monitor the progress of the report. School-based health center study recommended that we would contract with an outside entity to do an SBHC study, and that it would this study, that the school-based health centers would report to DPH. TCB is going to collaborate with DPH and CASBHC, the CASBAC, and OPM to design and develop the scope of the work for the study. So I think I want you all to take away is, even though some of the recommendations that TCB made to the legislature, where we had bills put forth, we had public hearings put forth, and then they went through the Appropriations Committee and the Human Services Committee and the Children's Committee. And then at the end, because this is what happens often at the end of session, is we run out of time just because of the number of bills and the amount of talking on bills. So we put those 3 bills that came through Approps, Human Services, and Children together. And unfortunately, we did not get them through at the last minute. But that does not mean that we're giving up. And we have another legislative session ahead of us come February. And in the interim, we are going to continue to work on these issues. So on this one, we are going to have the school-based work group monitor the progress of the study once we develop the scope of the study. So that's pretty much it on the legislative. I personally would have loved to come in here and tell you all, wow, we got it all done, but unfortunately we did not. So incremental. And that's it, unless Claudia, you have something else you want to add.
Just really appreciation for the work that you and Rep Exum did, getting us through the public hearing process and the organizing of a bill. Sometimes more importantly than the bill passing is having it as the vehicle that organizes so many of the key constituents to get around the table and to really point us in the right direction. And that clearly happened, and that's going to be our springboard moving forward. I also just want to give Christina from the Child Advocate Office a special shout out, because I know she was there with us at the very end, the last few days, making sure to advocate and talk to everyone. I think she spoke to maybe every single legislator that I had spoken to had already spoken to her first. So she did the work that I didn't need to worry about doing, because people were really bought in on the substance of the policy. And it just shows that this really is a team effort, and we're going to bring to bear every one of the voices we have on TCB come next time in February or sooner. Thank you.
That's true. And I did want to point out one other thing, which is Howard was we were going to nominate include in the TCB, the new Office of Behavioral Health Advocate as a member of TCB. And unfortunately, that legislation was inside of the bill that didn't pass. So while we do not have Howard as a voting member, as our new behavioral health advocate, we are delighted to have you here working alongside us, and we will get you on at some point, I promise. So
thank you. I don't doubt it.
So, okay. Then Emily.
Yes, I will take it from here. Okay, so I'm gonna briefly go over work group updates and schedules, and then a few administrative updates. Oh, I do see Alice has her hand raised.
I thought we were going to have a conversation or questions.
You are absolutely right, Alice. I was not meaning to skip over that. I just lost the thread.
I guess the first one, I just want to correct an information on there around the mobile crisis 24/7. That was not funded for 26. It was funded and put in 27. We have been told that we are to use any leftover money that we have to fund 24/7 for next year, which is unfortunate because there is none on our part. Some of the other agencies do, but the reality is that we are not going to be able to fund the 24/7 in year 2026. If you look at the bill, it says in 2027, the 8.6 million is in there. So that's an unfortunate situation. And then, of course, the UCCs are then unfunded also. So I know that there's a lot of conversations happening and people don't want to, certainly close them. But at this point, I know the UCCs are working together really hard to find the money to be able to do that. But the 24/7 is a grave concern, and just wanted to make sure you folks knew that that was where it was at.
So this is Claudio, if I can add some context. So we are aware that the funding was explicitly picked up in the general fund through 27. You'll recall that Mobile Crisis 24/7 expansion was an ARPA expansion. ARPA dollars run through the end of 26, calendar year 26. It's our understanding that DCF is taking inventory and has identified some remaining ARPA dollars that will be a significant portion of what we would need for 26, and that there's a commitment from all of us to work together to braid any other additional funding that may be needed for the end of 26 to get us to 27, at which time this fully comes onto the general fund and is built into the current services base. So I am not as dire as you are seeing the situation. I do think there's a path forward, and clearly having the signal of $27 being built into the general fund base as opposed to expiring ARPA dollars is a huge incentive to make sure that we just braid the funding necessary to get us through 26. But
I appreciate that.
Based on conversations we've had internally and with DCF.
That's great, Claudio. The information that we're getting is it's our own ARPA dollars that we were given. So if they were spent, then they are no longer available. So that communication should be made to the mobile crisis folks, because they're all working in lots of different ways trying to figure out how to keep it 24/7. Thank you.
Christina?
Thank you. I just wanted to get clarification on the UCC funding, because my original understanding was that none of the grant funds were in the budget. Then I think I saw a news article saying there was like $2 million in grant funding in the budget, which I think is inadequate for what's needed. And I just want to see if we can get clarity on what grant money, if any, is currently included in the budget, and just if there's any information on whether if there are any solutions to that shortfall. Last I heard, people were trying to work on solutions, but there was no resolution at that point. So I just want to see if we have any information about that.
Yeah, I can start and certainly open it up to others to chime in. Where we are with UCC. So UCC funding, you'll all recall, these again were initiated with ARPA dollars. So the first line is to make sure that we exhaust all the ARPA dollars, which still have until the end of 26 to be used. And that will provide some sort of additional runway. DCF has given us some feedback that at least 2 out of the 3 community-based UCCs have a significant reserve still built up of ARPA that's unspent that will help provide a runway for between 6 months to 12 months. So most of 26 would be covered with that. In addition, there is additional grant funding through the community services line of DSS. So the shift was made. The legislature moved from DCF's jurisdiction, where the ARPA dollars resided, to DSS under the community services line, a $2 million appropriation for 26 and an additional $1 million in 27 to continue to provide bridge funding until such time as the UCCs fully operationalize their commercial insurance billing. The one good thing when it comes to commercial insurance is that when these UCCs were created as part of the 5001 package a couple years ago, the legislative champions had the foresight to recognize that a key pillar of their ongoing sustainability would require not just state-funded support, but also commercial insurance. And we wanted to make sure that these services were available to all children, regardless of payer source. And they put in that bill not only a mandate for coverage, but a really powerful mandate that not only are UCCs to be covered by all state-regulated insurance plans, but that they be tiered favorably in such a way that they're out-of-pocket costs would be more favorable than the alternative, for example, an emergency department visit. So really trying to make it patient-friendly in terms of the coverage and the out-of-pocket costs that parents, families, guardians would have to incur by using them. So really good credit goes to the champions. And I know Representative Nuccio, with her insurance background, had a heavy hand to play in making sure that the insurance piece was well written. So that's going to be another piece of their sustainability. And then the final piece is there is, within the Medicaid line item, little over $7 million of funding for billings. So these UCCs, now that they've been stood up, will operate like a health service facility and be able to code and bill to different service lines. DSS has a bulletin out with several different billing codes, all of which would translate into some of the costs that we have seen by the UCCs and what they deliver to the Medicaid population. Medicaid expecting to be, roughly 50% of their billings and their patient population. So I think a key in this period of transition is to make sure that the UCCs have all the technical assistance they need to fully unlock those Medicaid dollars that have already been built into the budget. So when you take those three pieces together, that's a very significant pot of money, 7 plus 2 and 26, just on the state side, not to include all the commercial insurance and potential billing. And that's more than traditionally we've given with ARPA. So last year with ARPA, we gave $7 million for the UCC. So I think proportionately, the funding is there, just in different pockets. And I know there's a commitment across multiple state agencies to help support the transition of commercial billing and Medicaid billing so that those dollars can flow appropriately to the UCCs.
Thank you so much, Claudio. Any other, there's no way I could have done what you just did. It is a very learned area in all of the billing and also the budget. So any other questions? Tammy?
Thanks. And thank you, Claudio, for reviewing the kind of I mean, I think you really laid out like in some ways the long-term sustainability plan, which is going to have to be some blending of the commercial Medicaid and billing and grant support to sustain the model of the urgent crisis centers. I do think, like many things, those of us working to implement it, we find the devil is always in the details, and we're still working through those. And I know that providers have not yet been able to realize the billing guidance from DSS, but I really just wanted to speak up to say we've been felt very supportive recently and encouraged by the work that we're doing with DSS to try to resolve those billing challenges that we've been experiencing that prevent us from actually billing kind of at the top of that guidance, and really the department's openness to consider a case rate, which we have had some success in talking with commercial payers about. So I am hopeful that that continues to move in the right direction, and I do think that's the long-term path, but I will emphasize that we're not there yet.
Okay, thank you, Tammy. Emily, if there's no other questions, I will turn it back to you.
Sounds good. Okay, so I will be giving a brief overview of work group updates and administrative updates quickly. So the system infrastructure work group, the next meeting is July 15th from 3 to 4. We are currently focusing on systems of care, and our upcoming presentations will be from Tim Marshall and the tri-chairs of the CBHPIAB committee. Last month, we were able to have 3 presentations on systems of care around history of systems of care, processes of embedding systems of care in the current landscape in Connecticut. The services work group's next meeting will be July 9th from 2 to 3:30 p.m. over Zoom. Last month, we were able to have a presentation from CHDI and DCF on the crisis continuum study that we had just gone over. They will be helping us going forward, and this work group will be tracking and monitoring the progress of that study. Next, the school-based work group has been prioritizing the two priorities they put in their work plan, were the school-based health center recommendation and the school behavioral health services billing review. And at the July meeting, which will be July 7th, the work group will have an overview of the 2025 legislation, as well as have a presentation from Trauma-Informed Multi-Tiered System of Supports by Services Work Group Co-Chair Edith Boyle. And lastly, the prevention work group's next meeting will be June 26th. We'll be following up on our conversation had in May on early childhood. And also at the May meeting, we had a presentation from CEPI CT. And there will be no work group meetings for the month of August, as well as no TCB meeting. So I just wanted to put this on here quickly. The Yukon Innovations 2025 Training Institutes will be July 6th to the 10th. This will consist of a pre-institute training program, which will take place the first few days and will include an immersive learning experience with leaders and experts prior to the start of the main conference. And then July 8th through 10th will be the main conference. If interested, this is in the OneDrive link with the link to register. You can also reach out to me for more assistance. And then lastly, the Community Voices work group came to the committee in May and introduced themselves. This work group consists of providers of organizations from across the state that work with community members and families and children specifically who have behavioral health needs and supports. We are now opening up an individual application to ensure that community members with firsthand or secondhand experience in children's behavioral health are included in this work as well. So you can email me with any additional questions that you may have.
Terrific. Thank you for that update.
And our next agenda item will be, I'll be passing it along to Jill Farrell from the Yukon Innovations Institute.
Thank you, Emily. And I'm going to go ahead and share my screen. One moment. Okay. Okay, here we go. Is this showing both slides or just no, okay, just the main slide. Yes, thank you. Okay. Hi, everybody. My name's Jill Farrell, and I'm a research scientist at Innovations Institute. I've been supporting two main activities that are related to the TCB work. One is, One is the service array survey, and the second is a data infrastructure report. And I'm going to give you updates on both of those activities. Okay, and I seem to be transcribing. Is that showing up as well?
Yes, it is.
Do we know how to shut that off so it's not distracting? Okay, well, I'm just gonna keep going and we'll try to ignore it. Okay, the purpose of the provider survey, it's part of a larger landscape analysis that we're completing. And this is basically part of phase 1 of a project in which we're defining what services are currently available to children, youth, and family across Connecticut. What are the needs of children and youth for behavioral health needs of children and youth in Connecticut? And then trying to overlay that information to identify the most pressing service gaps. And then ultimately, this will lead to recommendations for the state via the TCB. The scope of the survey, it's broad. We used a charge of the TCB in order to define it. And so it includes prevention, early intervention, and treatment related to mental health, substance use, and developmental disabilities. In terms of developing the survey, given it's a broad frame in what we're trying to capture, we developed a service array subgroup as part of the services work group. It includes the services work group co-chairs, Edith Boyle and Jan Ponson, as well as additional providers and state agency partners. as well as others who have kind of come and joined when they can. This group's been instrumental in the design of the survey, and that we've initially kind of jumped in and started to draft what it would look like, and then realized we needed to step back for a moment and get to the foundation of what is the service array, what are the services that we're trying to find, and who do we want to ask? So what are the service providers types that we're going to be designing the survey for? So to do that, we again took a step back and pulled materials from the different state agencies who have been very helpful in providing service array information, looking through websites, service directories, reports, and creating the scaffolding of what is the service array continuum and the services provided within, how do we talk about them, and then what are the definitions, or what are the sites that we're going to query, and who are these entities that deliver services, because it ranges from a really broad spectrum, from primary healthcare all the way through hospitals. And so we use that framework to get specific about who would respond to this, and making sure that it would be something that they could respond to, given they're all from slightly different frames and sectors. In part of this process, we also met with a number of stakeholders individually who are experts in certain areas, such as schools or developmental disabilities, to ensure that what we were capturing could be, would get to the core of what types of services and who those services are provided to in their realm. The other trick of this survey was creating something that would provide us enough detailed information to answer kind of the big questions of what's available and what's not available, and where and for who, and ensuring that there was a lot of things we wanted to know, but ultimately had to strike just because it was getting too long. But through this process, we are just finalizing our pilot testing, in which the subgroup members were generous with their time to help go through it and provide feedback, as well as some volunteers who additionally signed up to help us. Given that we're interested in what service is available and where, and potential access issues, we determined that we would conduct the survey at the site level. So to understand who's responding, we have information related to just their name and address, as well as the type of setting they are, which we organized into 2 buckets of in-home / community-based, and then out-of-home or residential care. So within each of these, for instance, an in-home and community-based will have outpatient clinics, the community-based organizations, youth service bureaus, just the different types of agencies that provide services either in the community, in their clinics, or go to homes. And then the second type would be the residential settings, such as group homes, substance use treatment facilities, stuff like that. So then they respond to what are their catchment areas, so we understand their reach in terms of who's served. Given we know that workforce is a challenge, in particular recruiting or retaining staff, we do just have a couple items to try to get at their current staffing and vacancies. So we have that point in time estimate, and then and also to get at the size of their agency. And also related to size, we ask about overall number served in terms of individuals, as well as who types, there's an item that gets to the types of children and youth that they serve. So naming a number of characteristics or conditions, and then the providers are asked to indicate if that's a specialty population or someone that they could serve, but it's not their specialty, or someone who they can't serve. And so like an example would be children with eating disorders, or children involved DCF, something like that. Next, I'll review the service buckets, so to speak, in a moment, but for each of those, we ask if they provide a service, they would they'll select it and then answer a series of items for each service. So specifically, they'll indicate if they provide kind of generic modalities or using an evidence-based practice or promising practice, like something that is defined and we can understand kind of with detail of what it is and who it serves. But we also ask the ages served, the population of focus if relevant, such as if it's only available to children involved with a specific system or with specific conditions, as well as where the services are delivered. And then getting to some of the challenges that we know they may be facing in terms of wait lists. And there's a more generic item that has a laundry list of things they may be facing where they select their primary challenge, such as staff turnover or sustainable funding or maybe low referrals in some cases. So ultimately, when we're looking at this information, we can look at different service types or very specific ones and look for trends in what they're experiencing to see if there are ways, strategies that maybe the services work group or subgroup or one of the associated groups could dive into a bit more to help kind of get into that challenge and what we could do to resolve it. Briefly, here's a list of the service array buckets or types that we are assessing. So in theory, any of the sites we're querying could be providing any or one or all of these. And so they'll select. And then as they work through the survey, they would only respond to items if they provide this type of service. And then toward the end, there's a series of optional items. For those who do have the time and capacity to respond, we would love to know what are the most significant barriers families and youth are facing in accessing services in their area, at least from their lens, the provider lens, and as well as what are the most urgent behavioral health service gaps. And then if there's an item that lets them provide more information about their own services, and in particular, we prompt if they can elaborate on if they expect any funding challenges related to the current fiscal environment, things happening at the federal level. And finally, we ask if they have interest in offering additional behavioral health services and getting a little specific about that with the intent that as we identify gaps, we can use this information to understand about level of interest, essentially, in leaning in to fill gaps. We're using a survey platform called Qualtrics to disseminate the survey. It'll be a link, generic link in an email that has a letter from the Tri-Tiers attached. Thank you very much, by the way, that will summarize briefly what is the TCB, just in case this is going to folks who aren't familiar, the purpose of the survey and how the information will be used, and then encouraging people to complete it so that we can get good information. It'll also have a PDF of the survey attached so folks can reference that as they're going through the survey online. I'm going to presume in a lot of cases they might need to get information from different people. And so the PDF might be helpful. Although we also figured out a way for folks to collaborate and can give people that option if they have multiple people who need to feed information in. Our strategy will be to disseminate via all of you, TCB, as well as our partners at state agencies, related associations and their networks. Over the next week, we'll be reaching out to specific entities to make sure they're equipped with what we're doing and can help us push it down to their provider entities that they oversee or are related to make sure that they're able to support us and understand the timeline that we're working with. We need to finalize this strategy, but we're either going to record a webinar that goes through the purpose for those folks that would prefer to listen rather than read through everything, and or just provide virtual office hours where folks can pop in and ask questions. I've used that strategy in other efforts like this and find that pop in. Some don't really have questions, they just want to see what others ask. And we end up having a conversation that I think is helpful ultimately so that they can participate. And then we're available to attend stakeholder meetings and present what this is and answer questions and just try to round up more folks who could potentially participate and support this effort. We'll be tracking this closely in terms of who's responding, what types of providers, so that we can either reach out to kind of an oversight entity or association who's connected to those that maybe have a lower response rate, or to do some direct reach out even if we need to make sure we're getting some of the important stakeholder or providers to respond. And this will all be rolling back to the service array work group and ultimately the services work group, so we can keep everybody informed and hopefully get support as we push through this. I think it'll take a few months to get the level of responses that we hope to have. And then ultimately we'll be compiling all this information and bring it into those groups, and then a regional or some sort of stakeholder forum so folks can see it and respond to it and give us more feedback on what are the service gaps that are impacting their areas. Should I just go through this really quickly or pause for questions? Yeah, Tammy.
I am just curious. I think I'm probably going to have a million questions. You might see me in office hours,
Oh,
but
good.
just that on a surface, as a multi-service organization, I am thinking about the paperwork burden for our organization. And of course, I imagine we are not alone in thinking like, oh, this could take a little while to complete. But I was curious a little bit about scoping, and I wonder if you could just talk, just to kind of start, when you talk about prevention and early intervention services, how do you have a sense of how you're defining those? I mean, like youth recreation programs are prevention programs, and I'm guessing
Yeah.
you're not thinking about soccer camp. So I'm wondering where you're drawing your prevention, early intervention lines.
So we are going to provide brief descriptions of each of the service buckets to try to help with that. And then within each, if you select a service type, you'll get to the section where it lists a whole bunch of modalities or programs that are within that. I hope help prompt like the types of things that we're looking for. I think we'll get people submitting things that maybe fall a little bit out of scope, but that's, I'd rather them feel free to submit it and then we can figure out how to handle the information than not. So, and then we're willing to work with you, service providers of large agencies, in terms of timelines and stuff like that too, knowing that you have a lot on your plates.
Or hands.
What's that?
I said, or hands.
Or hands. Well, I don't know that I'm able to complete it for you, but to the extent that we can be helpful, I don't know, in pre-populating anything, I'd be willing to get creative because I understand the burden you have. And I appreciate the work you're putting into everything.
Thank you.
Yeah.
Having,
yeah.
I could comment, having piloted it, I'm not through it because of some stumbling blocks in terms of time. So I thought it would take 30 minutes or less. And it's probably going to take more like, per your point, Tammy, 45 minutes to an hour. But I don't think it's hours. Part of it is just a couple pieces of data that do need to be collected. And I think the other challenging piece is because is how expansive the very question around, is it more one site versus the expansive system, and figuring out that piece can be a little tricky, but so I think it's reasonable. It's more manageable than it might seem on first blush.
Thanks, Jan. And we'll get together and just do the final tweaks to tighten that up as well. So thanks for your feedback. Howard?
Yeah, hi. This I think is an incredible initiative. Thank you. But I noticed that part of it is to ask the providers to comment about barriers to care that they see that their clients are experiencing. And I'm wondering, has there been will there be an effort to actually go to our consumers and clients and ask them directly about their experience and their perception of the obstacles, which might actually be different than
Oh
what
yeah,
we hear from our providers?
I'm sure. Yeah. So our intent is to take this information and those forums that I mentioned that we'll hold later in the fall. I'd love to be able to put aggregated data up so people can see it and then have something to respond to. I imagine we would have a one or two or more related work groups or focus groups who can to get feedback from directly. If there's other ways or efforts that we can combine with, it would be wonderful to connect with folks to make sure that if we can just build in some questions or that it's already being there's already a focus group happening somewhere. Combining efforts would be wonderful. But yeah, we agree. We need to hear from the children and family themselves.
Thanks.
Alice?
I think Tammy was in front of me,
Oh.
if you don't mind.
I don't mind at all. Tammy?
Yeah, I'm just wondering about making sure there's things in there on if people give services, if that's inclusive of children with intellectual disabilities and other disabilities, because, our ICC sometimes say, oh, no, we can't do that population. So it does look like services are available to children, but it's not all children, even though they say, yes, anybody can come. It's not really true. And then, how behavioral health was defined. Some people define behavioral health as true behavioral health. Someone has a behavioral health need, and some define it as only a mental health need. And here it's like interchanged, or it says behavioral / mental health. And if that's clearly defined in this, to make sure we're all using the same language. I'm on a few children's behavioral health teams, and I don't think we all speak the same language because we all go at it with our own lens. So
Yeah.
we
That
want
was
to
yeah.
we want to have the same language. We want to all be on the same page, but I think just because of our lens, sometimes it's not. And so when I see surveys like this, I think they're great, and the amount of time that you put into it is incredible. But is it going to give someone like me, who works for the Department of Developmental Services, any information about what's truly available to that population? Because we know people don't go into treatment because they have ID. That's not why you're seeking additional supports and services. That's not why you're hospitalized. That's not why those services are needed. But we do need those services because our kids and our adults are just like everybody else and have this other need. So do you think it captures that at all?
We have worked to ensure that it would capture that, specifically services that children with IDD could access. We're in the throes of finalizing. If you want to take a quick peek at it, just to make sure that it's kind of get to what you're hoping to, well, capture and then also avoid. And to respond to your other comment, the behavioral / mental health was purposeful because the folks have different lenses on what the definition is. So to address it at this point, we went with the /. We are providing a definition. All of these definitions, I think it'd be a great task for the services work group or a subgroup just to flesh through a really comprehensive glossary of terms that all partners can kind of agree to or work from, at least, and when doing anything related to this type of work. So
well, thank you so much.
We started it, and I don't think what we started is going to be the final definitions of all of these things, but to try to put something stake in the ground that then we can work from.
Thank you.
Thanks, Tammy. Yes, Alice.
Great. Just a couple things. One, DCF in December 24 required us to give updated information of all DCF um, programs. And, we both had to give the numbers treated, third-party billable, some of the questions that you are asking. And so I just want to give you a heads up that that data is with DCF and you might want to try to access that so you can make sure you're
Thank
getting
you.
everything you need. The other thing is that I think when you're asking around wait lists, that's a bit of a funky question in Connecticut because
Yes.
of the ECC standards. And so you might want to sort of think about that in a bit of a different way. Although all of us are so desperate right now in terms of not having enough staff that or funding that we're even admitting the wait lists are real. But at this point, you're going to get a kind of a distorted answer unless you ask it in a clear way for Connecticut. And then the other thing is that I would encourage you to collect the data on the other things like Tammy's soccer team. I don't know if you said soccer or baseball. But those are efforts that a lot of the folks who are in the community who have built in terms of making community connections for kids and families that, we would testify, frankly, is part of our system of care. So even though it may not be evidence-based, trauma treatment, there are services, our basketball league, our parents support groups, and all those kinds of things that are not funded but are delivered because the community is very interested in having them. So I'm hoping you'll make sure people can give that data to. Thank you.
I think the survey is definitely flexible enough for somebody to be able to enter that somewhere. I guess the question would be how targeted we would be to get, if it works their way, the survey works its way to providers who offer that, they should be able to enter it. There could be other targeted efforts though to go broad. So we'll see. Thank you, Alice. Waitlist is hard, by the way. Lots of debates on how to word that. It's a very nuanced issue with many dimensions that we've talked through and just trying to nail down, something fairly generic of what are you carrying wait list?
I think there are going to be a lot of grays, and that's where the other and the comment sections are important. Alice, what I think of the ECC, another one is I forget the exact time right, but 2 hours, 2 days, 2 weeks. So technically you can provide urgent care as a UCC, urgent access or urgent care, which could come under crisis care. But in all practicalities, that's really actually difficult to meet that mandate with the wait list and the demand.
Well, the
So
crisis call has to go through 211, Jan. You can't
Yeah.
do it if the family walks in.
Yeah, no, but I'm just thinking in terms of like what are definitions, right? Or if you can see someone within 2 hours, are you, is that like what is, some people I think are going to have just questions in terms of formal definitions.
Thank you.
I think the last thing I'll comment on, kind of related to that, is my hope for this survey is that it's ultimately kind of the scaffolding of what is the service array and challenges for access and availability. And it'll give us enough information to start to hone in on where are the big gaps and challenges that providers are facing. So then there subsequently will be deeper dives into all of this and pieces that go to the data group and other groups to try to really start operationalizing and specifying where there needs to be more. So getting this thing to perfect is not happening, but I think we have put forth a good effort to get a lot of information that we can do something with. So, should I move on to the data report?
Yes, please.
Okay. So it's actually got a much larger title of children's behavioral health system data infrastructure and use of data for system improvement. Recommendations for Connecticut's public child and family serving behavioral health system. So the intent of this report is to provide an overview of data infrastructure and quality improvement processes and structures related to children's behavioral health to give people language around what it is, what that means globally, and then also what that means in Connecticut. And so before going into the content a little bit more, I'd like to acknowledge my co-authors, which included Bert Plant, who many of you know from his many years at DCF and Carillon. He was very instrumental in helping to chart out the landscape of Connecticut and the systems and the relevant data systems. And I don't know that I could have done this without him. And Terry Shaw, who's my colleague at the University of Maryland. And Terry had started his career in an integrated data system in one state, and then has since been involved in many efforts across the country. So he was able to provide really great perspective on best practice models in terms of data infrastructure, innovative things that states are doing, or certain counties that might be relevant for the TCB to look at. So that the report content includes an initial overview of what is data infrastructure. So, what are the components, and there are some general definitions so that people have language when working through this report, and what they should be looking for. Then we go into model approaches that, like I just mentioned, that Terry assisted with. So particularly for something like children's behavioral health, which is pulling across multiple systems, integrated data is very necessary. And so we kind of focus largely in integrated data systems and interoperable systems, and talk about kind of common structures as well across the country, as well as some state-specific examples. And then some examples from other sectors that have tried to address issues that are relevant to the TCB, such as tracking referrals and wait lists and stuff like that. Then we move into Connecticut's infrastructure. And this is where Bert was instrumental, and we ended up charting out the major data systems and then scheduling basically structured interviews with the state entities that manage the system so that they could talk through the scope of the system, the purpose of it, and the strengths of it, as well as the challenges they face, and that those all got summarized in that profile section at the end. But in the body of the report, we summarize it so that you kind of have a snapshot of the key data systems and what they can offer, as well as some of the limitations that they face too in terms of answering questions that might be of relevance to the TCB. And so we go through that and summarize recommendations based on the information provided. The recommendations largely focus on activities that a data subgroup or committee could potentially tackle. And then finally, we close with there's a glossary that we started that also might be helpful for the larger TCB, and just including in this catalog of terms that could be good for common language across all stakeholders, as well as those profiles I mentioned about the specific systems. So then people start to get a sense of the landscape of what's there, what's not there, and what everyone could be working toward. I think that's it. Unless you want more.
Well, just the timing outline.
Oh, sorry. Yeah. It's in the final throes, so it should be under final reviews now. I think most likely it'll be released in July, but we are very close. It's literally final reviews at this point.
And I know that we've all participated in that at the TCB leadership, the tri-chairs. But when do you anticipate having all the data back to you, and when do you expect to be providing a report back to TCB?
Oh, are you talking about the survey?
Yes.
Not the data infrastructure.
No, I
Okay.
apologize. I should have asked earlier.
No problem. Sorry. It's okay. The two things. So for the service array, the service array survey should be going out, I think, within the next week. I think we're that close. I do want to confirm with folks who we want to help push with dissemination so that we are all lined up. And then there was just the final things that we need to work through from the final feedback. I believe we'll be collecting data really through the summer, knowing all that's on people's plates and then summer, and compiling it September, October with the goal of summarized information that people can start to review in forums, either here, focus groups in the late October, November area. The report writing, because it's part of a larger landscape analysis that'll include some summary of population needs as well. And we want to include the feedback we're getting from these forums. So what we'll do is package briefs of the information from the survey that can be used to help inform like legislative session information, like recommendations. But the larger report won't be available till the spring. We pull together everything from focus groups and stuff like that. But minimally, we can do the short packages of things to the help guide, where you guys would like to go with some of the information that we're pulling up.
Okay, terrific. Thank you. Does anyone else have any questions? It looks like we are good to go. Thank you.
Thank you.
Okay, Emily.
So that was the last item on our agenda. I will say our next TCB meeting will be July 23rd from 2 to 3:30 hybrid at the LOB and on Zoom, and there will be no August meeting.
Okay, terrific. Well, I just want to thank, I know that this is, having filled out these surveys or similar surveys in the past, it does take time. It does take sort of dedicated people. It also does take searching out information to be able to report in the survey. So I want to not gloss over that I truly do understand that we're asking a lot, but the goal and the hope is that what we are going to learn will significantly inform the work we do going forward. We've really been trying to get this landscape analysis to understand what services are and all
I'm in a
of
meeting, but it's going to be in.
So I do want to just thank you all in advance for when you do get the survey to making sure that we get the results back so that we can be informed. I know it's a lot. I really do, Edith. I know it's a big request, and it actually almost needs a dedicated person who then has to search out a lot of information to include. So, and yet it's really important if we're really going to move the work forward. So that's it for me. Thank you to all of you. And Claudia, I'll turn it over to you.
Thank you, everyone. Thanks also for bearing with me as I was dealing with IT issues today. It was a really good conversation. Glad we had a chance to recap what did pass, what's funded, where there are challenges that we're going to all have to be very mindful of moving forward. But I do take great heart that we got the right team and the right commitment level among TCB. So looking forward to a summer and regrouping in the next few months. Thank you.
And thank you, Emily, for keeping us all on track. This was amazing, right on time. Thanks, everyone.
Thank you.
Thank you.